as a woman, you must know that breast cancer is a leading type of cancer in all types of cancer. So it's one of the commonest cancer. Now, this has been the case for a very long time, and I don't see it reducing anytime in the future. What you need to be aware that just by being a woman, it puts you at a risk of developing a breast cancer in your lifetime. Now, as you know, what is happening now is people are living longer, and the moment if you start living longer, then the chance of having any type of cancer, and in this case, the chances of developing breast cancer can be very high. So women need to be really aware that they need to exercise all precautions and be part of all the screening that is being offered nationally and internationally. Most of the healthcare systems in the developed world offer a standard screening system. Women should use that opportunity and get themselves seen by the general practitioners or their doctors and make sure that they have regular screening. The other thing is also learn how to do self-examination. So I would recommend that, at anyone who is growing up should be taught how to do self-examination and have regular breast examinations, so that if you feel that there's something abnormal, you can identify it nice and early, and you can contact your doctor. If we catch the breast cancer early, the chances are we can get rid of it. So this is very important to know. If you catch it early, the chances are we might be able to get rid of it. And that offers a glimmer of hope for a vast majority of population, because a large number of patients do present early. And as you know, that is the success of our screening, but also the success of the new types of medications and new types of treatment modalities that we've developed. So be alert, be proactive, and ask for help when you need it. Yes, it is increasing. And one of the reasons it is increasing is because we are now very successful in screening techniques, and we are picking up cancers very early, and we are proactively screening for cancer and looking for breast cancer. And because of that, we are identifying a lot of early cancer that would not have been identified until it was late. The other thing is also that our lifestyles have changed. People are living longer, but we have developed what I would call is a kind of lifestyle that is conducive to development of different types of cancer, including breast cancer. So higher consumption of alcohol, higher consumption of fatty diet, or what we call as typical Western style diet, and also smoking contributes to this. And like I was explaining to you earlier, even having a person live longer puts you at a risk of developing breast cancer. In addition to that, there are a lot of other external factors. Let's say, for example, if someone is having prolonged exposure to contraceptive pills, it is believed that also increases the risk of developing breast cancer to some extent. So it is rising, but we're catching them early. And what is encouraging to know that the mortality, which means people dying of breast cancer, has stabilized if it has not dropped already. So this is really encouraging. So you see the numbers are rising, but we are able to take care of it with the new treatment options and modalities. A lot of risk factors associated with breast cancer are generic to lots of other types of cancer. So smoking, alcohol consumption, exposure to hormone treatment, if you've got previous family history of breast cancer. And in the same way, I would like to mention that there are certain genetic predispositions that will predispose you to cancers. One of them is the very famous BRCA, which is BRCA. There are two types of BRCA. These are gene mutations. If they are present, you're very likely to get breast cancer. Then there is PALP mutation, and there are several, but it is basically if you've got strong family history, more than 2 member of family or 1 to 2 member of very close members of family having breast cancer, it is better to be alert. The other risk factors would include, having a dense breast or large breast. Um, and it is said that, even if you have children, it sometimes offers protections from breast cancer. So these are some associations and some risk factors. Majority of them are modifiable, especially if it comes to, say, diet, smoking, alcohol. If you adopt a healthy lifestyle, healthy diet, avoid smoking and drinking excessively, you can definitely reduce the risk of developing breast cancer. Yeah, so one of the risk factors that I was telling you about was the presence of certain hereditary genetic mutations. Now, what we have found over the years, thanks to the extensive amount of research done by my colleagues and people all over the world, is that breast cancer is not just a single disease. It's not a single disease entity. It may be a single organ, but there are several different types of breast cancer, and they have their own unique genetic mutation. Now, by nature, cancer develops because of presence of some certain genetic anomaly in cancer cells. So a normal cell that has genetic anomaly, because of which the cell forgets when to stop dividing and when to stop growing, it develops into cancer. Certain well-known genetic predispositions include the BRCA1 and BRCA2 genetic mutation. Okay. Now, there is small but significant number of population that carry this genetic mutation. Many times people will not know whether they've got this history, but one of the ways to identify it is look at your family history, look at your family tree. If you've got a lot of cancer in your family, if you've got your ancestors who die young because of cancer or who've been diagnosed at a very young age, that is an indication that you need to get yourself checked. The other thing is also if you develop cancer very early in your life, which means if you are less than 50 years or 40 years of age and you develop cancer, you will be offered a genetic test because generally the cancer will develop in a later life, but if it develops early, you will have to identify whether it is a genetic predisposition to that. Now, there is a panel of genes that have been identified to be associated with which is associated with high risk of development of breast cancer. We have been able to even use this information to minimize or reduce the risk of incidence, but also to use it in treatment modalities. If you've got a strong family history and if you're curious, you can always contact a specialist or come and see us, and then we can go through your history. So we have come a long way in terms of treatment of breast cancer. So I'm going to only talk about management of early breast cancer. Now you must remember there's a difference between what is classified as early breast cancer in the UK is cancer that is confined to the breast and is reasonably small in size and can be resected, and we can offer a curative treatment for that. So in general, you will be able to classify breast cancer as early breast cancer, locally advanced, or metastatic breast cancer. Metastatic breast cancer is a type of cancer where the cancer cells have jumped from the site of origin, which is breast in this case, and has gone to different other organs. In that case, it is termed as incurable but treatable. But in early breast cancer, our treatment options are really numerous and there are exciting new developments. So for example, if you have a lump in the breast, you will come and see us or one of my surgical colleagues. We'll run some investigations, and if based on the investigation, we'll decide what kind of treatment options you might be offered. Now, development of breast cancer can be quite traumatic for women, and it is understandable because they're not only scared for their life, but also because of the aesthetics, because it also affects their body image. In our part of the world and in our practice, we offer breast conserving surgery whenever possible, which means if we think we are able to remove the cancer without affecting the aesthetic look or without affecting the body image of a patient, we would do that. The discussions are quite extensive and it is done in a specialist MDT where few of us, including the oncologists, radiologists, the surgeons, breast care nurses, all of us sit together, look at the history. And when that happens, if a person is offered surgery, they go and have the surgery. After surgery, they might have some extra tests based on which we will be able to offer them different types of treatment. So, for example, if the cancer is of the type which carries hormone receptor, we will give them hormone treatment. If there are other risk factors, we will give them chemotherapy. There are certain types of cancer that carry special markers called the HER2 receptors. In that case, we offer them the biological treatment such as Herceptin. And this is called as adjuvant chemotherapy or adjuvant systemic therapy, which is done after surgery. A vast majority of these patients will also be exposed to radiotherapy. Now, radiotherapy is strong radiation given on the breast tissue or the chest or near the neck to prevent a relapse of the cancer in the local place. Now, we are also when we're talking about breast conserving surgery, we have also moved significantly positively in the direction of offering preoperative chemotherapy. That has become a standard of care for a vast majority of patients, because what we want to do is to try and shrink the cancer as much as we can, so it can offer the opportunity to our surgeon colleague to offer the best possible surgery and the best cosmetic result to the patient. So what we do here is we offer a combination of different drugs based on the histology of the cancer in order to shrink the cancer as much as possible. And I'm really proud to say that Nottingham is actually in the forefront of breast conserving surgery and also offering neoadjuvant chemotherapy.